Hi everyone, I'm Philip. I'm one of the practitioners here at Psoriasis Eczema Clinic. And today I'd like to talk to you a little bit more about a very common question we get asked in clinic with patients when they're suffering from skin conditions such as psoriasis and eczema. How can I be more comfortable at night if I have a skin condition that is flaring? Well, to answer that question, it's useful to explore the reasons why often our skin is more uncomfortable at night. If, for example, itching might feel worse, your skin might be burning or hot, the dryness feels terrible and you're uncomfortable. One of the big reasons people get itchy at night is because their level of distraction drops. So during the daytime, even if you're still itchy, usually that itch is not that noticeable because you are distracted with work or with family or other things you might be doing. But at night, all of that distraction goes. You get in bed and even a low level itch might feel worse. Often when we get in bed, we're warm. You might cover up with a doona. You'll feel warm, and histamine feeds on heat, which will make you scratch. As soon as you start scratching, histamine will be stimulated even more, and the scratch gets worse. And then the histamine rises, the heat builds up, and so you get caught up in that itch and scratch cycle. If you get dry skin at night, one of the big reasons is because your skin is inflamed. There's an accelerated turnover of skin cells. All the top skin layers get pushed off more rapidly and the dryness accelerates. This makes you feel very uncomfortable at night. So how do we counteract this issue? Well, the first thing we need to do if we have a flaring skin condition at night is to make sure that we're not too hot. Have a cool bath, a cool shower before bed. If you have a very dry skin condition, an oil in the bath might be helpful. You can use any oil you're comfortable with. Simple oils like coconut oil or hemp oil or olive oil are useful. If you haven't tried these before, always test them first on a little patch of affected skin to see how they go, of course. If you have any prescribed treatments or ointments, always apply them straight after your shower before bed. Have your shower or your bath, towel dry the skin, and then apply your prescribed moisturizer. Wait about an hour or so it can get into your skin, and then go to bed. Very important, if it is hot where you are, don't get too hot in bed. Use a layering system rather than a doona. A cotton sheet with a couple of cotton layers, hospital blankets, flight blankets are useful as well. That way you can get rid of extra layers if you start to feel hot. Sleep in just the underwear. Really light clothing, for example, helps as well. Sometimes people use really cold applications on the skin at night. An esky by the bedside with icy water in it and a tea towel or a towel that you rinse out and then apply to that itchy hot area often will stop it and give you some relief right away. Sometimes it's useful to get up at night and re-moisturize if you're having a flare-up, rather than to try and soldier on right through if you're very dry. Very important also, if it is summer, it's hot, to use your aircon, not all night, but use it until bedtime, and then put a fan on and make sure that you're moving cool air across the body at night. Don't be too hot. The same applies in winter time. If you have a heater on, switch the heater off at night. The extra heat on the ambient temperature will just accelerate that heat and the flare up on the skin. Itching at night is often compounded by dehydration, so it's important to make sure that you are drinking enough water during the day. If you go to bed dehydrated, your histamine will already start to rise. That causes the itch and scratch cycle to take off again. Follow the dietary recommendations your practitioner discussed with you. Very important, because it will cool you down and decrease histamine levels as well. Okay, I hope these are useful.